to 69 years old or 70 and older. 90% of those persons felt that they had speech impairment was a non-motor symptom. And then in persons who were, when the groups were separated by duration of diagnosis or disease, so 6 years or more, speech disturbance again was ranked in the top 4 non-motor symptoms that people reported. So how many people had a referral to speech therapy? So this is really the dismal statement down here on the bottom. We know, I mean, if there's anything I think we know, when Dr. Goldman talked this morning, there's a lot we don't know about what causes Parkinson's, but more and more at every conference I attend and participate in, what we do know is that exercise helps. It's neuroprotective, it slows down the loss of dopamine, it can help re-strengthen muscles. So why are only 12 to 16% of patients getting referred to physical and speech therapy? Because the doctors are waiting for symptoms. I have had patients tell me that. I just saw a gentleman this week. He's had a diagnosis of Parkinson's for 16 years. He had deep brain stimulation 4 years ago. He's very dyskinetic, you know, those wiggly movements. His speech is moderately to severely impaired. And he and his wife sat with me during the initial consult and told me that 4 neurologists and 1 neurosurgeon over the course of his disease, not one referred him for a speech-language consult. They requested it. So, my friends, if you have Parkinson's disease, which I imagine it's why you're here, and you have never had a referral for a therapy consult, I would encourage you to request that. It doesn't mean that you have to go through weeks or months of therapy. You may only be 1 consult, and it may be 1 consult where a therapist helps set up a program for you to begin. The sooner you begin, the better. It's much easier before you're having symptoms than later when you're now trying to make muscles that have already changed do work that they're not doing very well. So what do we have to offer as speech-language pathologists at present? The Lee Silverman Voice Treatment is a speech voice therapy program. It is considered the gold standard. So the lead researchers who developed that program have been publishing research over the last 20 years that show us it works, kind of why it works. It has to be delivered by a certified clinician. But it's not rocket science. It's a voice exercise program. And really, even after 16 intensive visits, intensive for you, intensive for me, because I'm cheering you on the whole time, it's still exercise. So you can't do it and then think, oh, man, glad that's over with. What you should learn in that 16 weeks is a program that you can continue to carry out to maintain the changes and the improvements you've made and to prevent as long as you can any further changes in voice. But in the future, and not too distant future, are some device interventions. And I personally find these very exciting because 2 of them at least employ a method that I've used for about the last 5 years, and that is auditory masking as a method of making people louder. So devices are any type of little portable device that's designed to improve speech and communication in persons with Parkinson's. And here's a few of them. So the Speech Vibe, which is right here, looks like a little behind-the-ear hearing aid. It was designed by Jessica Huber, a speech researcher at Purdue. And it uses auditory masking to elicit a reflex that we have that's preserved in most people, a Lombard reflex, and that's our tendency to talk over background noise. So here's the easiest example, and you can try it at home tonight. If you have a little Walkman radio or transistor radio that has some headphones, put it in, turn it up kind of loud, don't want to hurt your hearing, but kind of loud so that when your wife says it's time for dinner, you say, what? Because you're talking over the background noise. So that's the principle. Auditory masking was first used back in the 1970s for people who stutter as a way of reducing stuttering. And so I periodically email Dr. Huber because I can't wait till the device is ready, and they're hopeful that in 2013 that device will be available. On the bottom is iParkinsons. That already is available. That is an app, an application to be used with an iPod or an iPad. And it was developed by a fella at Casa Futura, which is in Boulder, Colorado. He himself is a stutterer. So he's had a device for a number of years, which was developed for people who stutter. He's taken some of that technology, sort of revamped it, put it into iParkinsons. The app, should you have a speech-language pathologist who wants to try it, is free to a speech pathologist. The iPod and the program for purchase by an individual with PD, I believe, is $1,000, but you can check at his site. And then the Vocalog is a monitoring device. So the current design, they probably will continue to improve the design. There's a little looks like a little collar. And it's a device which allows two things: to monitor voice use for a 2-week period of time. So I can have a program in my computer that prints out a graph and actually shows me when you leave my treatment area or I leave your home how you're actually using your voice when I'm not around or when you're not in therapy. So it collects data, and then it also has the ability for me to set a threshold of loudness. So if normally you talk like this, and I want you to talk like this, and you normally talk at 45 decibels, and I want you to talk at 65 decibels, I'm going to set that threshold so that every time you fall below it, you're either going to get a beep or a vibration, so something that reminds you to be louder. So those are in the not too far off future. And then sometimes you just need help. I'm astounded over my career, particularly in Florida with a primarily Medicare population, how many people have hearing aids, never use them. This is a big loop, you know. What goes in affects what comes out. And amplification is another thing that I'm always surprised is not offered more to people. I've put a voice amplifier on people who could barely utter a word when I first see them, and we continue to communicate for the rest of the hour. An amplifier just gives you power. And it's curious to me because when I suggest it to patients, oftentimes they will say, well, will I get dependent on it? I don't want to be dependent on it. And I always think, isn't that weird? Because I see walkers and canes and wheeling walkers and all kinds of assistive devices. I don't think you're using them because you want to be more dependent. I think you're using them because you want to be more independent. You want to be safe and stable when you're ambulating. So to me, an amplifier, why not pop it on if you can enjoy spending time with your family and actually communicating with them instead of having them ask you to repeat every few minutes. All right, so I need to rush here. Voice aerobics, you've done a little bit. No need to drive anywhere. You can practice it every day at home on your own. Even my patients that have mild dementia have been able to use it successfully on their own. Nothing to remember, just focus on posture, breath support, and voice. Therapist guided. I'm going to kind of skip through this. This was just a little product survey that I did last year because I was curious about people who were purchasing the DVD or CD, but did they find it beneficial? It's a little bit scary to ask. Did it work? Just like when we finish therapy and ask a patient to complete a patient satisfaction form, it's kind of scary to ask. Did it work? And so some of the things people reported was that they liked using the program because it was easy to follow, it was portable, the CD they could use in the car, it was affordable, the DVD is only $20. And then when I asked questions about specifically what did you notice, people reported that on days when they used the program, they often felt that they were more aware of how they were using breath support. There's a group, a Parkinsons group down in Naples, Florida, who have been doing a weekly voice aerobics class since I did a lecture at last March. And some of those members have reported that they notice less tremor after they've used the program. So I'm interested always what people find, what benefit they find. A colleague of mine, a researcher at Kent State University, is hoping this spring to begin some research actually looking at what components of voice aerobics actually complement a traditional voice therapy. So you all know exercise is invaluable. We all know that, with or without Parkinson's, right? We have an obesity epidemic. We all read and hear every day that we need to exercise. And I think the more easy I can make that for people, put something in their hands, something they can take home, the greater likelihood they will do it. Own it. Your problem if you got it. Really encourage you to, when you leave here today, if it's important to you, make a commitment to maybe undertaking some voice therapy. And then I'm going to just close by making a few comments. I write a blog. If you know what that is, it's just on the computer. I write articles, hopefully educative articles for patients. So in one of my blogs, I talked about really voice as being the essence of who you are. I think because Parkinson's is classified as a movement disorder, a great deal of attention is paid to tremors and stiffness and motor function, certainly what the medications address and even what deep brain stimulation addresses. But we're not our bodies. We heard that this morning in the last lecture right before lunch. We're really much more than that. And for me, the passion that drives what I do is that I believe in our voice and our power to communicate is really where we connect. That's really where we make the connection. And so when a patient says to me, well, I just don't talk so much anymore, and I don't have to worry about repeating, I think, well, okay, that's one way of managing the problem, but what about your wife? Don't you think she misses communicating with you? So when I see someone who maybe has improved movement because of medications or surgery, but their voice is barely audible, their speech barely intelligible, and so they're not talking very much at all, I see that person fading away from the important relationships in their lives. So again, the message I send you off with today is I think you need to use everything available to you to preserve that wonderful gift that we have and to strengthen it if you can. And hence my mission. And when I, in 2008, formed a little company, Voice Aerobics, later to become a private practice, I thought, how do I, in a really clear way, state what is really my mission? And this is it. And it's to really enlist individuals in their own care and through education and through treatment to empower all of you to maximize function. So you can, you have little bookmarks that have my website you can visit. That's Frankie, my registered therapy dog. And he goes with me a lot to patients' homes where I share a clinic with a PT. He comes there with me a lot too. And I was telling them last night at dinner, I'm like insignificant. The usual routine is, oh, Frankie's here. And then, hello, I'm here. So, all right. I think I have to stop. So we have time for any questions? Okay.